Welcome to adapting class. If you have a few days to take your test and you're looking for a very short content regarding renal system, this is the crash course, less than 10 minutes. Things that at least you have to know at the tip of your fingers. They're likely to ask you questions on that. So let me show you. First thing, you have to know the difference between acute and chronic kidney disease and what is involved. Usually your kidney work. When you get into trouble, you get into acute kidney injury. If you don't take care of it, it becomes a chronic. So chronic and acute problem. In acute phase, your kidney shut down. There's different stages, three stages: oliguric, then diuretic, and the recovery. In the oliguric stage, that means less urine output, your kidney cannot do anything, you are retaining fluid. So there is fluid retention. Your kidney does not work, it can't get rid of potassium. So you have to know how to take care of potassium, management of potassium. You should not give this guy a lot of fluid just because he's not peeing, because he's retaining. So this is where you restrict fluid. So in the first stage, oliguric stage, you restrict fluid. It does not mean you don't give them fluid, but you don't give them 120, 130 ml per hour. You will probably get 30, 50 ml per hour. You have to watch for potassium and sodium. In the diuretic phase, that means the kidney is now crazy. It's not trying to recover, but it doesn't know what to do. And therefore, the urine output is high, 200, 300 ml per hour. In the process, it looks like the kidney is in what? Diabetes insipidus. It loses a lot of fluid. In the process, you're going to become dehydrated. So, what is the main idea, main management, main concept regarding diuretic phase of the kidney injury is what? Hypovolemia and hypotension. So, give them fluid and monitor their blood pressure. That's all. If you don't take care of them, they go into chronic kidney disease. In chronic kidney disease, it's like acute stage, but everything the kidney does is now not working properly. It's not shut down, but it's not working properly. You have fluid overload, you have metabolic acidosis because you're holding on to all the chemicals, right? The kidney is responsible for maintaining anemia, right? Taking care of your hemoglobin. There is a hormone that is responsible, hypotension, that help with the secretion and production of red blood cell. When you have kidney problem, chronic kidney, you cannot secrete those hypotension, and therefore you become anemia of chronic disease. That's what we call it. Not because you're losing fluid or you're losing blood, but you have anemia of chronic disease. That is why all people with chronic kidney disease, they have a prescription for hypotension. When you're hypotension, the number one thing you have to do, hemoglobin should not go past 11 or 1 gram, okay? Based on what they give you. So don't go past that. Hey, you become a dialysis patient, two things they may ask you: dialysis induced hypotension, dialysis um, disequilibrium syndrome. They have different mechanism. Disequilibrium is mostly neurological problem, and hypotension is due to um, cardiovascular problem. That means dialysis-induced hypotension is a cardiovascular problem. So look for signs and symptoms about cardiovascular issue. For disequilibrium, look for signs and symptoms about what? Neurological symptoms. I'm giving you key facts that it's just a summary, right? What do the NCLEX want you to know about UTI and pyelonephritis? Key concept: UTI, urinary tract infection, more common in female because of the way their urethra is short. It's more common in pregnancy. Diabetic, if you have a catheter, or if you have stasis of your urine, you can't pee too much, urine stay there, you get infected. What are the symptoms? When it's going to burn when you have urine, and you're going to go more often because it's of irritation frequency. You can be urgent, you have to go, you can't hold it, and sometimes because of the inflammation, there's blood in it. If you progress into your kidney, we call it pyelonephritis, and you start having back pain, frank pain, because your kidney is on your back, and you start having fever, chills, and this one, you need antibiotic for sure, right? How do you prevent this? Key concept, select or apply, you should expect UTI, void after sex, right? Increase a lot of fluid. You wipe from front to back, right? Bubble bath, and your underwear, you got to choose cotton, right? All this thing is very, very important that the NCLEX may ask you. BPH, key concept you have to know in prostate cancer. Benign prostatic hyperplasia is in male. The prostate get bigger and bigger and bigger, right? It causes obstruction because the urethra go through the prostate, right? You have urinary retention. It take a while to initiate and it take a while to maintain it. You wake up multiple times in the night because your urine is small, 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 dribbling. What do you do? What is the management? We need to relax it, the prostate, or we need to make it smaller. The finasteride are the one that make it smaller, but tamsulosin, the flow mass, is going to open up to flow. What is the major side effect of this? Orthostatic hypotension. So you take it at night. If it doesn't work, we do TURP. What does that mean? Transurethral resection of the prostate. You have to know key concepts associated with that, especially continuous bladder irrigation and the indication of prioritization. Check out Dr. NCLEX for more content. This is just a crash course to help you guide you. These are the things I need to know about everything on renal. If they ask you about prostate cancer, they want you to distinguish between BPH. And the key fact is it's painless, it's not painful, it's hard and nodular, and is irregular in shape when you feel it through the rectum. Incontinence. This one, they can be confusing, but I'll show you the key fact, right? Key concept. Stress incontinence is under stress, right? It's a stress. So when you laugh, when you sneeze, the urine leak is because it's being stretched, right? When you cough, what do you do? Improve your pelvic floor. So Kegel exercise is the best thing. Edge means you cannot hold it for a long time. Sudden strong edge to void. What do you want to do? Train your bladder or take medication to slow it down. That means anticholinergic, oxybutins. Overflow means it takes you a while you can't even feel it that you are full. When the bladder it takes a while for you to be able to have the urge to go pee. The bladder get chronically dilated and you retain more fluid, right? And therefore then you dribbled. It's different from urge that you cannot hold it. These people, they can hold it as long as they can. But you do intermittent catheterization, put the follow in an empty bladder and relax the bladder. If the patient has surgery or something post-op and they cannot pee, urinary retention, put the follow in after 6 to 8 hours. There's some certain pediatric urogenital condition you're supposed to know. Hypospadias. The urethra usually go through the penile area and right in the middle. If the urethral orifice open below the gland of the penis, you go below it so that urine doesn't shoot straight, it shoot down. It's a problem. In male, we got to fix it. Usually surgery. After surgery, no bathtub until the Foley is removed. Key concept. What is nephrotic syndrome? This is an autoimmune disease where you have massive loss of protein, and therefore loss of protein, hypoalbuminemia will lead to what? Edema, fluid retention, hypertension. What is the treatment? Corticosteroid, steroid. What are they risks of? Infection. You need to lower sodium to prevent further fluid retention. Second one, acute glomerulonephritis. They are different. This one is an inflammation of the glomerulus that you leaking completely. So your urine is what? Dark, is very dark, is bloody, right? Hematuria, massive, T colored, is suspected. What is the priority? Hypertension. You get to the point your kidney cannot do anything. Now you hold on to fluid, and the first sign is what? Hypertension. So watch for that. Testicular torsion, right eye riding of the testicle, and it's very severe, painful, unilateral in a kid. It's a B sharp movement. If you don't do anything, they will lose their testicles. 4 to 6 hours, they have to do surgery. If you come to hemodialysis, two things: hypotension, dialysis reduce hypotension, or disequilibrium. Same thing. I've already explained it to you. One is a neurological, one is a cardiovascular. Peritoneal dialysis, you have to know what it is. You have to know what are the intervention, what are the bad ones. Peritoneal fluid that is cloudy is bad. If it's a female and they are in menses, you should expect their output to look like pinkish. All these things you have to know. If you see a feculent, there's obstruction. If there is no drainage, make sure they don't have constipation and you can let them move around. These are concepts. You come to fistula care. Hey, anybody who have AV fistula, you cannot draw blood pressure there. You cannot draw IV. You cannot draw blood. And make sure they massage the area or using stress ball to improve blood flow. These are NCLEX concepts you need to know for um, renal disease. Straightforward crash course for you. Take care of yourself and bye.